be talking to you. You've been using a product for quite some time, so I'm sure that your interest today is understanding a little bit about how you get your reimbursements, how you can qualify for stimulus and ARRA, and a little bit about the process of filing for it and qualifying for it and product, etc. So we're going to start with just a little bit of generalization. So the first thing to share is, all of you know, the stimulus was announced about now almost 2 years ago. And when it was first done, it was done very quickly in the Obama administration. So it was done within days of him being in office. And with that, it took quite some time for legislation to figure out exactly what that was. So a very, very large piece of legislation with very few details behind it. Spent the next year trying to really figure out what that was. And that's why we've all been sitting on pins and needles trying to figure out, how is it going to apply to me? Can I qualify, etc. The key things that the legislation was trying to do with stimulus and with ARRA is to really drive improvement of quality patient care. I mean, that's really the key thing. And for those of you, obviously, on an EMR today, you've already made that decision. But this has been a process for a long time. The government has spent a lot of time trying to get clinicians to switch to an electronic medical record, and having very strong difficulty doing so because people didn't want to have the investment of cost. They didn't want to have the investment of changing their processes and their practices. And it's been very difficult for them to get this to happen. So very important was they've done a lot of different things over time. Leapfrog, if some of you knew about Leapfrog initiatives, but there's been a lot of different initiatives where it really has proven that if you use an electronic medical record, it truly is going to improve quality care, but also reduce cost. And as you know, with aging population, our costs are going to increase significantly over the next several years. So there's really more than just one initiative here that would obviously be improving care, but it's also in reducing cost. So the government's been trying at this for quite some time to get adoption, and adoption is very, very low, less than 20% adoption in the nation. So this time around, instead of just having an initiative where they were trying to incentivize, they also have a stick process. So there's two pieces of the actual stimulus payment. There is the carrot and the stick. And so what does that mean? So the carrot is the incentives that start in January of this coming year, 2011, and continue on, and according to whether you're Medicaid or Medicare is the time frame for which you could actually qualify for those payments. But the second piece of that is the penalty piece. So this time around, they're not just actually incentivizing you to do it, they're actually going to penalize you if you do not do it. And we're going to talk about these specifics as we go through the presentation today. As I said, you know, adoption rate has been very, very low. And their goal this time is they absolutely want to have significant adoption in the next 5 years. That is really important. If they're going to increase quality care, if they're going to reduce cost, they have to have significant adoption. So therefore, the carrot and the stick.